Report says elderly people in England and Wales are being failed by the services designed to care for them.
The NHS Confederation says too many people end up at A&E with problems that could have been treated earlier.
We're joined now from our Birmingham newsroom by Mark Newbold, who's from the NHS Commission, which carried out the report. Very good morning to you. Thank you for your time this morning. First of all, important to outline the nature of the problem that you're trying to address. What is the problem?
Well, we're calling for a fundamental change in the way services to older people are delivered. Older people are quite often living with multiple medical conditions and are taking support from a wide range of professionals, and we're arguing that these need to be coordinated much differently around the needs of the patient and driven by the patient and their own needs and preferences, which is turning the present system on their head. Most professionals are working for often different organisations and tend to be bound by the rigid rules and processes that they follow. So we're arguing that we need to coordinate these multiplicity of services much better around the patient, and we've seen evidence that this can work. There are pockets of very good practice across the country, and we studied those.
Now, it's often a theme we hear from people who are reviewing care, this idea of joined-up thinking. Can you give me an example of how that would work in practice and how it's not working right now?
If I give you an example of Age UK, we're running a system in Cornwall which is looking after several thousand people who are at higher risk of acute illness, and they've got a multidisciplinary team of all the different professionals involved in older people's care, but they have a care coordinator who links very closely with the patient and their carer, so that all the decisions taken are coming directly from the patient, and the patient only has to talk to the coordinator. They don't have to work out which of the many providers that they deal with they have to contact in any given circumstance.
Now, one of the things people say, and indeed elderly people themselves say, is the one place you don't want to be when you're elderly is in hospital.
Hospitals are for everybody, including older people, and if older people have an acute illness requiring hospital treatment, that's where they should be. And the best hospitals have specific ways of handling older people when they arrive at the accident and emergency department. So we've looked at the Royal Berkshire Hospital in Reading and Sheffield Teaching Hospitals. They have specialist teams specialising in the care of the elderly who meet the older person at the front door and can make a comprehensive assessment immediately.
Well, that's interesting, isn't it? Because the suggestion, the presumption there is that the experience of being in a hospital can be particularly traumatic for someone who's elderly.
It can be, but what we're arguing for is hospitals have their place in the treatment of the elderly, of course, but what they shouldn't be used is to as a fail-safe when other systems of care in the home aren't available. And so we're arguing for a much greater emphasis put on care that supports people to remain well and in their own home, so that hospitals are used only when they're needed. And similarly, when older people have been in hospital, it's very important that those home care services can pick them up and support them after they're recovering from their acute illness, so that they can leave hospital in a timely fashion and not have a delayed discharge.
And Dr. Newbold, so much to do with care, and the NHS revolves around money. Can this be done effectively, cost-effectively?
Well, all change requires some funding to help it to happen, but the model of care that we're proposing is not inherently more expensive. And what we're seeing at the moment, actually, is that with hospitals being used, if you like, to fill the gaps in services in home and community care, then we're incurring costs that we need not incur. And more importantly, we're not providing the optimum care for older people.
Dr. Mark Newbold, thank you very much this morning.